Parkinson's disease is a life-changing condition with no cure, affecting nearly 1 million people in the U.S. Just ahead of Parkinson's Awareness Month in April, we're discussing a new initiative this morning that aims to support those experiencing symptoms. Joining me to explain, Dr. Matthew Stern, along with patient and advocate Stephen DeWitt. Good morning, gentlemen.
Good morning, Kelly.
Kelly.
Thanks for having us.
Dr. Stern, we'll start with you. What is Parkinson's and how does the disease affect patients?
So Parkinson's disease is a very common neurodegenerative disease that, as you said, affects about 1 million patients in the United States. The common symptoms, the ones that everybody recognizes, are tremor, slowness, loss of dexterity, muscle rigidity. But the not so common symptoms can be things like depression and anxiety and pain and constipation and a myriad of other symptoms that can affect a patient's quality of life.
And Steve, if you don't mind, we'd like to hear your story this morning about being diagnosed and living with Parkinson's.
Well, it started in March of 2005. I'd had a slight little twitch in my left pinky, and that twitch went from 1 finger to 2 fingers to 3, and eventually the hand started to all shake, along with a kind of a dead left arm. It kind of just hung by my side. And I went to see the physician about it, and it's a difficult disease to diagnose. It's clinically diagnosed. It's not something that they take blood work or a brain scan and say, you have Parkinson's. You have to really examine the patient and check for rigidities and some of the symptoms that Dr. Stern just spoke about. And we came up with the conclusion that it was Parkinson's, which then starts your life into a different direction. And it starts me and others in the area of examining what the disease is and how to treat it. And that's what Live Well, Do Tell encourages. Patients to research their condition, and when they go to see their physicians, be very open and honest about what they're experiencing so that the physician can make the most positive diagnosis that they can.
Let's dive into that a little bit more. Doctor, explain the Live Well, Do Well initiative, and then explain why is that campaign so important?
So this is a campaign that has been sponsored by Accorda Therapeutics with a group of stakeholders, thought leaders, physicians like myself, patients like Steve, caregivers, advocacy groups. And the reason it's so important is that physicians have a limited time with a patient. And physicians are often focusing on the obvious symptoms, things like tremor. But that's not what affects patients' quality of life. For every patient, it may be different. It may be depression, it may be anxiety, it may be fatigue. But the reason this initiative is so important is that it enables an honest and complete dialogue between patient and physician. Patients first have to understand what it is that is affecting their quality of life and then learn how to communicate it effectively with their physicians. So it's essentially, this is a patient empowerment initiative, and that's why it's so important.
And gentlemen, either of you can answer this question. What is your greatest hope for the Parkinson's community through Live Well, Do Tell?
You start.
Well, we think that with the expanded dialogue that we're talking about now, that it's going to create more research opportunities and possibly some new treatments in the future to help us with the quality of life issues that we're challenged with now.
You know, my interest as a clinician who sees many of these patients is that a patient can come in and have an understanding of what it is that affects their own sense of well-being. And for each of us, it's different. And so we're hoping, my hope as a clinician is that a patient can come in and say, look, you may see a tremor in me, but that's not what bothers me. What bothers me is I get fatigued, I'm depressed, I wake up in the middle of the night, so that we can address in a concrete and focused way the symptoms that are affecting that particular individual.
Well, thanks so much for your time this morning. And the website for more information is livewelldotell.org. Thanks, guys.
Thanks, Kelly.
Mike, over to you.